So what we have actually done now is that our original study was a pilot study, and now we have looked at a much larger cohort of patients. In fact, there's 25,000 patients in this cohort. And one of the things that's very, very important that's come to light, and this is published information, so it's freely available, is that there is a correlation, and it's an inverse correlation with BMI and PSA. Now, what does that mean? It basically means that, as your BMI increases, in other words, if you're over 25 and less than 30, you're in the overweight, and over 30, that puts you into the obese category. What we see, and as I say, this is published, is that PSA levels decrease with BMI, which means that if you have a high BMI and you go to your GP and get your bloods done, your TPSA will be more likely to be normal, which means these particular patients, if they have cancer, are going to be missed because they're going to be sent home saying, you have a normal PSA. So what we did was we put the TPSA test, looking at BMI, against our prostate cancer risk score. And what we have found is our prostate cancer risk score is independent of BMI. In other words, our prostate cancer risk score does not depend on whether a person is overweight, is obese, because we will pick up the cancers in this particular patient cohort. And this is the first time this has actually been shown that our prostate cancer risk score will actually outperform TPSA, especially in these patients who are overweight and potentially obese.